Hello everyone. Today the video will be on distributive shock, which includes neurogenic shock, septic shock, and anaphylactic shock. So let's get started. Distributive shock is a medical condition in which blood is inappropriately distributed in the vasculature, resulting in inadequate supply to the body's organ and tissues. As we all know that the arterial and venous system must maintain a certain tension in order to maintain the blood pressure. But in distributive shock, because of the vasculature has relaxed and dilated to the point of inadequacy, the blood pressure drops. The distributive shock is of three types: neurogenic shock, septic shock, and anaphylactic shock. In today's video, I will be explaining about each type of distributive shock in detail. Neurogenic shock. Neurogenic shock is a type of distributive shock which results in hypotension, often with bradycardia, due to disruption in the autonomic nervous system pathways. Here, there is damage to the central nervous system, which could be in the spinal cord or traumatic brain injury. In neurogenic shock, the body loses its ability to activate the sympathetic nervous system so that only parasympathetic tone remains. This leads to decreased systemic vascular resistance and low blood pressure. Also, there is bradycardia because of the vagal response is unopposed by a sympathetic nervous system response. Neurogenic shock is a potentially devastating complication which can lead to multiple organ dysfunction and death if not promptly treated. Coming to the pathophysiology of neurogenic shock, because of injury in the brain or spinal cord, there is disruption of the sympathetic tone, which will lead to venous and arterial vasodilatation and cause decreased venous return and decreased preload. This will further lead to decrease in the stroke volume and decrease in the cardiac output. Because of unopposed parasympathetic response, the heart rate is also slowed, and this will further lead to decrease in the cardiac output. So the combined effect will be a drop in the blood pressure. Signs and symptoms of patients with neurogenic shock. The patients undergoing neurogenic shock will experience instantaneous hypotension due to sudden massive vasodilatation and decrease in blood oxygen saturation. Because of vasodilatation and inability to constrict blood vessels, the skin remains warm and flushed in neurogenic shock. The patient can also experience priapism due to vasodilatation, and because of the unopposed parasympathetic tone, here the patient will experience bradycardia. Treatment in cases of neurogenic shock. Patient should be given intravenous fluids. Norepinephrine is the most common first-line vasopressor in neurogenic shock for treatment of patients who doesn't respond well to hypertension treatments such as fluid resuscitation. Dopamine is often used in combination with other vasopressors. It is not the best first-line vasopressor as it increases the chances of arrhythmias. Antidiuretic hormone is another vasopressor which can often be used in combination with norepinephrine. And atropine is administered for bradycardia. Anaphylactic shock can occur whenever there is an allergic response. Because of the allergic response, there is a release of large quantities of immunological mediators like histamines, prostaglandins, and leukotrienes from the mast cells, which lead to systemic vasodilatation, causing a sudden drop in the blood pressure and edema of bronchial mucosa, resulting in bronchoconstriction and difficulty in breathing. If left untreated, anaphylactic shock can lead to death in a matter of minutes. So it is very important to treat anaphylactic shock as soon as possible. Pathophysiology of anaphylactic shock. Because of exposure to the allergen, there is an antigen-antibody mediated reaction in the body which causes activation of mast cells and basophils and release of histamines, bradykinin, and leukotrienes like mediators. These mediators causes vasodilatation and cause increased capillary permeability, which will lead to cell fluid shifting and development of edema, causing swelling in the skin, eyes, and lips, and also laryngeal edema, which leads to difficulty of breathing and stridor. Also, the histamine will trigger an itchiness and redness like reaction in the skin. Because of the vasodilatation, there is maldistribution of blood, which causes a decrease in the venous return, decrease in the cardiac output and tissue perfusion, and sudden drop in the blood pressure. The symptoms and signs of anaphylactic shock. In anaphylactic shock, the patient will experience low blood pressure, his pulse will be rapid, weak, and thready, the skin will be cool and clammy, patient could experience shortness of breath and breathing difficulties, his tongue can be swollen, and he will be unable to swallow. The skin will show hives, redness, itching, and swelling. Patient will also experience nausea, vomiting, diarrhea, and abdominal cramps, and he can also lose his consciousness. The diagnosis of anaphylactic shock is a clinical diagnosis and is made in the setting of acute onset of criteria like typical skin features, for example, urticaria, flushing, or angioedema, plus involvement of respiratory system or cardiovascular system, or patients having persistent severe gastrointestinal symptoms. Also, the patient can present with hypotension, bronchospasm, even if typical skin features are not present. So, a detailed history of pre-hospital events is vital to confirm anaphylaxis and its associated trigger. Coming to the treatment part of anaphylactic shock, cardiopulmonary resuscitation should be administered if required. The drug of choice for the treatment of anaphylactic shock is epinephrine, as it reduces the body's allergic response. Patients should be given oxygen as required. Intravenous antihistamines and cortisons can be given to reduce the inflammation of air passages and improve breathing. Also, beta agonist can be administered to relieve breathing symptoms. Septic shock is a potentially fatal medical condition which occurs when there is sepsis. Because of sepsis, there is multiple organ damage in response to infection, which can lead to dangerously low blood pressure and abnormalities in cellular metabolism. Septic shock is primarily caused by bacteria, but it can also be caused by fungus, viruses, or parasites. Pathophysiology of septic shock. In septic shock, because of the causative agent, bacteria, virus, fungus, or parasite, there will be release of cytokines by the WBCs in response to the infection. These inflammatory cytokines cause loosening of the endothelial cell tight junction and makes the blood vessels leaky, and there is increased permeability which causes accumulation of protein rich edema throughout the body, and this impedes the tissue perfusion. The signs and symptoms of septic shock. The patient with septic shock may experience anxiety, restlessness, tachypnea followed by respiratory distress or respiratory failure. Initially, he will experience tachycardia, which is followed by bradycardia. The blood pressure of patients with septic shock is low. The skin will be warm initially, and later they can exhibit cool and clammy skin. The body temperature is altered. There could be fever or there could be hypothermia. The patient's urinary output is less and there can be loss of consciousness. Diagnosis of septic shock is generally done by a workup which includes blood culture, arterial blood gases, complete blood counts, serum lactate, chest x-ray or other radiological investigations, kidney function test, liver function test, and blood glucose levels are also done. For the treatment of septic shock, intravenous fluids like normal saline or ringer lactate can be given. An early antibiotic administration should be started with broad spectrum antibiotics, and later when the culture sensitivity reports comes, the antibiotic could be changed according to the sensitivity. Vasopressors like norepinephrine is preferred over dopamine. Patient could be given oxygen depending on his requirement, and also supportive measures should be taken depending on the dysfunction of the organ involved. I hope this video was useful for you. If you all want me to cover any topic of your choice, you can write in the comment section below and I will definitely make a video on your suggested topic. Thank you.